So what you're watching here is episode 2 of the Chronicles of the Boy with the Broken Back. Well, that broke his own back. Well, I didn't break it. I just hurt myself lifting. So what you're watching here is me fixing myself with my own machine. So again, this is the Spine Specialist Robotic Laser Enhanced Spinal Decompression System. As you can see, there is a traction at the end here and a robotic laser that is underneath my back, hitting me with laser, softening and relaxing everything as it stretches me. So day 2, yesterday, after treatment I was about 80% better, and that continued until I went to bed. And I woke up this morning probably still better than I was yesterday, but I would say my entire recovery right now, I'm about 60% better than I was. So I came back about 20% or so. Just I'm a little stiff. So I came in this morning to make sure that I get on it quick, because that is a big secret with respect to these problems, making sure that you take care of it before it becomes a bigger problem. So a lot of the mistakes people make are, well, it'll go away, it'll go away. Well, sometimes it does. Sometimes it gets exponentially worse. And I know, for what I'm feeling, just because I know what to look for, this is going to get worse if I don't take care of it, which is why I'm in here on my own machine this morning when I could be home, in the warm comfort of home doing my computer work like I usually do on Wednesdays, but I knew I better come out and get this done. So, so my case history, for the doctors watching, I have Sherman's disease. So if you look at my x-rays look like I'm about 90 years old. I have not very many disc spaces. I have herniations. I have Schmorl's nodes, which means the discs in my low back have actually herniated right up into the vertebral bodies. So not out into the nerves, but out into the vertebral bodies. So that can create some chronic pain. I've had chronic pain. My low back doesn't bother me usually too much. My neck is usually the problem. So I know when the low back starts, giving me pokes, then I got to get on it, because lumbar disc issues, they're severely debilitating if you don't take care of them. So that's really my point this morning, is that if you've got an issue in your back, make sure you have a look at it. Make sure that you take care of it. Make sure you don't neglect it, because when you neglect it, it often becomes worse and it becomes a harder thing to take care of. What I'm going to be doing is I'm going to be in here every day, stretching my back, doing the laser and the decompression to make sure that I take care of it quickly. That's the importance of doing treatment 3 or 4 times a week if you have a problem like this, because you need that stimulus to make sure that the body heals. So I'm going to be respecting that. For the doctors that are watching this that want a new tool to try to help their patients, one of the biggest benefits of this device is that you can treat acute low back pain. So somebody like me that's been in some pain to the point where he's having a hard time moving around, with regular decompression you have to be fairly careful with that. If somebody's in spasm and inflamed and has a hot disc, it's hard to treat it because it's so painful that it doesn't respond to the stretch very well. With this, the laser softens and relaxes everything. So right now, as the machine is stretching me, I have the laser working underneath me that's softening and relaxing everything. It did my entire low back, and I know my disc pain is about L5S1 area. I have the laser programmed to do everything, and then it comes back and it focuses its last few minutes right on L5S1. So now what's happening is you're stretching everything and relaxing it, and then you go back to the area where the problem is. You double dose it with laser just to relax it even more, and that way the traction pull actually stretches it and relaxes it. So if you're a patient needing some help with a back, neck, knee, or hip problem, we have a new solution here for you. If you're a doctor that's looking to make your office different and be able to treat some things that you're not able to treat now, you might have heard hip problems. We have a hip decompression program on this as well. So these are things, new niches, new things that you can help patients with, which is good for your business, which is great for your patients. It's great for everybody. Thanks so much for watching. Hope this helps you, and we'll see what happens tomorrow.